So the next patient we have is a 35-year-old named Grant who has bladder cancer. His partner has asked for an urgent review because he's been confused and vomiting over the last day. It's probably sounding like he has delirium, so we're going to do a delirium screen called the 4AT. Have you done this before?
No, I haven't done this before.
So I'll quickly run through it with you. The
Yes.
4AT has 4 sections. The first we will look for a level of alertness and we'll score accordingly. Then we'll do a brief cognitive screen and we'll do the AMT4,
Yes.
which asks for the age, date of birth, where they currently are and the year.
Yeah.
Then we assess for attention, where we ask the patient to state the months of the year out loud backwards, starting at December and going to January, and score accordingly. And then the last, we assess if it's an acute change or a fluctuating course. Maximum score is 12, with scores of 4 or more indicating a likely delirium.
I have one question for you. Can you first explain the actual change or fluctuating course?
Yes, so delirium is an acute medical condition. So we like to see if this change has only occurred within the last 2 weeks and still present in the last 24 hours. And we'll ask the partner, Ben, if this is the case. And what I'll do is I'll do the assessment and we'll score it together.
So one more question. So after we done this screen test and the person has the delirium, so what can we do for them?
Then we need to determine the cause, and delirium is most often multifactorial, and we'll probably order some further tests for Grant today.
Okay.
All right,
Thank
you ready to go?
Yes.
Good morning, Ben. My name's
Hi.
Amy. I'm the nurse
Hi, Amy.
practitioner. And this is Judge. She's
Hi,
the
Judge.
student nurse. She's going to be sitting in today, if that's okay.
Yeah.
Hi, Grant. How are you today? I believe you're a bit worried about Grant this
Yes.
morning. Can you tell me what's been happening?
Yeah, he has been vomiting from since this morning, and he feels generally unwell, and he's confused and disorientated and vague. So I'm a bit worried about that because he rarely responds to me. So I'm just bringing him here.
And he's not normally like this.
No.
And he had chemotherapy 2 weeks ago, is that
Yes,
right?
yes, but that's quite normal until this morning.
So very, very different for Grant.
Yes.
I'm just going to ask Grant a few questions. So,
Sure.
Judge, this is where we'll go through the 4AT. So
Okay.
I'll do it, but you score, and then we can compare our scores.
Okay. Yes.
Grant, can you please tell me your full name?
I'm Grant.
And what's your address, Grant? And can you tell me your age?
Thirty, 36, 35, I don't know.
And your date of birth? Can you tell me where we currently are, Grant?
We're home.
And what year is it, Grant?
I don't know what you mean. Don't I?
And this is going to be a tricky one, Grant. Can you state the months of the year out loud backwards for me, starting at December and working your way through to January? That's all right. And Ben, you said he's never been this confused
Yeah,
before.
so he's being like that, so I'm very worried about him.
And just in the last 24 hours?
Yes, this morning.
So what score did you get, Jaichi?
I don't know.
I got 12.
Yes, so did I.
Okay.
So this means that Grant is likely having a delirium.
Yeah.
Because he's had recent chemotherapy and he's been vomiting over the last 24 hours,
Right.
it might be because he's dehydrated and he might have an
right.
acute kidney injury.
Yep.
So what I'm going to do is I'm going to order some blood tests.
Okay.
So you can just go next door
Yep.
and get them collected,
Yep.
and a urine sample.
Okay.
And I'm going to give you a script for some antiemetics to
Okay.
try and stop the vomiting.
Right. No problem.
Whenever Grant can, encourage him to have fluids and small amounts of food, and bring him back tomorrow and we'll see how he's going, and I'll have the blood test results by tomorrow. But if there's any concerns in the middle of the night, take him to the emergency department.
No problem.
Do you have any other questions for me?
No, but just keep him vomiting, so he cannot really drink a little bit water. It's not.
So the tablets that I'll give you, the
Yep.
script that I'll give you for the tablets
Okay.
will help control the vomiting.
Okay.
To
Yeah,
hopefully
that's great.
allow him to get some more food intake and
Okay.
drink intake.
Okay. Thank you, Amy.
I'll see you tomorrow, Grant.